What is the Child-Pugh score for esophageal varices? Imagine trying to understand how severe liver disease is and how it might affect other complications like esophageal varices. The Child-Pugh score is a tool doctors use to do just that. It was created to assess how advanced liver cirrhosis is and predict how well a person might do over time. While it does not directly diagnose esophageal varices, it helps estimate the risk of developing these enlarged veins in the esophagus, which can sometimes bleed dangerously. The score looks at 5 key factors. First is encephalopathy, which is a change in brain function caused by liver problems. It can be mild or severe. Next is ascites, the buildup of fluid in the abdomen, which can also be mild or severe. Then there are blood tests, bilirubin levels, which measure how well the liver is processing waste, and serum albumin, a protein made by the liver that indicates how healthy the liver cells are. Lastly, the score considers how long it takes blood to clot, measured by prothrombin time or the international normalized ratio, which reflects the liver's ability to produce clotting factors. Each of these 5 factors is scored from 1 to 3 points, with 1 indicating normal or mild issues and 3 indicating severe problems. When you add up all the points, the total score can range from 5 to 15. A score of 5 or 6 means the liver is still functioning pretty well, which is called Class A. Scores from 7 to 9 fall into Class B, showing more significant liver impairment. Scores from 10 to 15 are Class C, indicating advanced disease with a poorer outlook. Now, how does this relate to esophageal varices? Studies have shown that patients with higher Child-Pugh scores, especially in Class B and C, tend to have more severe and larger varices. For example, a score around 8 points is often used as a cutoff to predict the presence of varices with good accuracy. This means that if a patient has a score above this level, they are more likely to have dangerous varices that could bleed. This information helps doctors decide who should get an endoscopy, a procedure to look inside the esophagus for varices. Patients with higher scores are at greater risk and benefit from early screening and management to prevent bleeding. The Child-Pugh score is a useful part of the overall assessment of liver health and helps guide treatment decisions, including whether to start medications or consider procedures to reduce bleeding risk. In summary, the Child-Pugh score is a valuable tool that reflects how well the liver is working and how likely a person is to develop serious complications like esophageal varices. It is not a direct test for varices but provides important clues about who might be at higher risk. Always remember, if you or someone you know has liver disease, consulting a health care professional is essential for personalized advice and proper management.